Hey everybody, good afternoon. I am Dustin Strong and this is Strong on Health, and it's Tuesday, which means normally we go live at 12:45, but today we're going live at 1:45. We have a once a month event where we go to Premier Yoga and Fitness, Carla's Yoga Studio, and we do what's called a nutrition happy hour. So I was there doing that today, so we're doing this just a little bit late. But for those of you who still have questions coming in, now's your chance. You can email them to us at info@strongonhealth, or you can text them in right now and I can do my best to answer them right now. Our goal is to make sure that we're giving you the information that you need to make the most informed decision about your health and make sure you're empowered with knowledge that will help keep you strong and healthy throughout the rest of your life. Okay, so, and if any of you are interested in us doing a nutrition happy hour, we're happy to give you some more information about that. Basically, I go to your company and answer questions live, trying to help keep everybody healthy and happy in the business and making sure that you're being successful there too. Okay, we're going to start out because we've got a great success story. We have a number of clients that come to us that are doctors, and as they are working in their area of specialty, sometimes they are not practicing and keeping their mind present on other aspects of it. And nutrition can blend into all aspects of health. And so I get a lot of really interesting questions. And I had one of the doctors that I'm working with asking me if there's anything or any way that we might be able to support his eye health, because he was struggling with glaucoma. And we talked about a few different things. And I was really, really excited to get this email from him. He said, hey, I went to the eye guy. Pressure 6 months ago was 28. Started the good eye and circulation stuff, right? And pressure as of now is 18. What do you think of that? So I thought that was really, really cool that he was taking the time to share with us the successes that he's had, being able to integrate some different aspects of health and just how it affects your whole body. And for him to have that result really, really kind of made my heart happy. When I was speaking to everyone this morning about this success, the question came up, well, I thought the only thing you could do for that is surgery. And I think that's a really good point for us to talk about. Now, surgery, there is a time and a place, of course. Now, but what I always want to tell people is that just because you're getting a surgical procedure done doesn't mean that it has corrected necessarily why you had to get that procedure done. We talk a lot about this when people have their gallbladders removed. Just because you've had your gallbladder removed doesn't address why you had to have your gallbladder removed in the first place. So you always want to make sure you're taking that information and looking first to see, is there something that can be corrected that can get the body back to healing itself, so that don't have to necessarily go to the point where we have something so final and so irreversible as a surgery. So always making sure that you're asking more and more questions. And I think surgeons are brilliant and they're wonderful and they're absolutely necessary. But when you are a hammer, everything kind of looks like a nail. If you're a surgeon, that's the solution that you're used to thinking of. So they may not be thinking of things outside of that as far as like what could be causing or what could be contributing to it. And you want to make sure that you're expanding the way that you're thinking about this, and even maybe help them expand the way they think about it and ask them questions like, is there something I can do? Is there an exercise I can do to help so I don't have to have this? Or is there anything in your knowledge that could help prevent me from having to have this surgery or have other surgeries? Just don't be afraid to ask those questions, guys, because your body can heal itself given the right conditions, given the right obstacles removed. In most situations, your body is doing everything it can to get yourself healthy. So keep asking those questions when it comes to that. Okay. Oh, and yes, it is day 13 of the Reboot. We've got so many great successes out there. I want to give a shout out to my buddy Aaron, who's lost 20 pounds already on the Reboot. That was actually a few days ago, so he's killing it. He's doing a great job. And my buddy Matt, I think he was like 8 pounds in the first week, so you guys are just doing great. I want to keep you guys encouraged. Those early successes are going to keep making sure that you're getting dividends on that. So it's just going to be mounting on top of mounting success when you do that. So now your body is able to get back to the business of all the other things that it's been trying to heal, because you're getting rid of all of the stuff that was slowing it down from healing. So keep that going. And when you start to have these gains, I want to encourage you guys that this isn't just a quick fix. It's not something that you just do in a short period of time. You want to start taking the habits and the things that you've learned and find a way that you can blend them into your life going forward. One of the things I always talk about is picking that one day of the week that is your health investment day. It is the day that no matter what, you're doing everything that day that is going to be helping your body move towards a healthful state. And what that means is maybe you're eating exactly like you are on the Reboot that one day of the week. See if you can figure out the day of the week that you can commit to so that it becomes a habit, it becomes something that you don't lose the practice of being able to do too. So if you do another reboot, it's even easier every time you do it. And I encourage you to expand that beyond just one day if you can. Maybe it's 4 days a week. And if you can get to the point where you have 4 days a week where you're doing all these things for your health and just 3 days a week where you're making some questionable choices, then you're getting a net gain every week, and overall you're moving yourself towards health. So find ways that you can take the gains that you're making right now and bring them forward with you throughout the rest of your life, because that's really what it's about, is getting that self-knowledge, understanding the things that make you feel bad, that give you a headache, that drain your energy, and figuring out a way that you can avoid keeping them in the equation, and bringing in those things that you are right now learning are actually helping making you stronger and healthier. We have a gratitude pumpkin over here for people to be writing what they're grateful for up until Thanksgiving, and we also had a pumpkin over here for the reasons that people are doing the reboot. And we just wanted to share, we had a really awesome one. We had someone come and write in, the reason that they're doing it is because she loves herself. She's actually loving herself enough that she wants to take care of herself and make sure that she's healthy and feeling good. And I really thought that was pretty encouraging and exciting that somebody recognizes that when you're doing these things, it is because you love yourself. So keep maintaining those gains. If you have any questions or you need more inspiration to keep you going all the way up until the 21st, let us know. We're here to keep you encouraged. We're here to give you all the reasons that we're doing it. We could go over and read all of the reasons that people have written down, because there's so many benefits that you can get from making these choices of removing all of those obstacles to healing and making sure you're getting all those things in there that your body needs for it. The featured food today on the Reboot is blueberries, and I think blueberries are an excellent addition. As you know, we do actually usually keep blueberries here in the office, and that's something almost every morning I'm having a very small handful of blueberries. So if you haven't done that yet, try to blend those in, even if it's just a couple of berries in the morning. Actually had someone earlier saying how they have a hard time eating anything in the morning. They feel a little bit sick, but they want to because they know that they feel a little bit more energy when they do. And so the suggestion was, well, what about just a little bit of fruit, like some berries and maybe a little bit of raw nuts and seeds? And they say, actually, when I do that, I feel a little better. So sometimes just getting a little bit of breakfast is better than not having any at all, as opposed to trying to cram in this massive breakfast. So there's always the next right thing you do and a good solution you can do for that. So those are all the things I think that we had questions for. Oh, except we have one more question that just came in about rheumatoid arthritis. We have somebody who's actually inquiring for a friend of theirs who's 71. They have rheumatoid arthritis. They're not really internet savvy, so they're asking them for, and they want to know, is there anything that we can do? I just want to be clear. We don't attempt to treat conditions here. We're not looking to diagnose or treat anything. What we're actually just looking at is identifying any way that we can remove obstacles to people's health and support the body's ability to heal. And when we start to really examine how deficient the American diet is in so many things that are absolutely essential for health. There's so many chemical processes happening in your body all day long that require so many nutrients, so many molecules of magnesium and zinc and iron and copper and chromium. All of these are essential, and if you're not getting them in the equation, your body can't do the job. It just can't get it done. It's just sitting there waiting for the right tools to be there for it to get it done. And so when we're talking about whatever the condition is, we're just looking at this person as an individual, examining what is missing. Where are the obvious missing pieces in this puzzle, and what are some of the things that could be removed that may be hurting that person more than ever? We identified this week a young lady was having some very, very unusual problems, and she couldn't figure out what was going on, and we identified that she's been using this aluminum deodorant or antiperspirant, and she discovered that that is a major piece of the puzzle in making her feel better. There's so much information out there now about how that aluminum-based deodorant or antiperspirant is contributing to lots of problems, and specifically breast cancers. And so we want to make sure that people are aware that is something that would be identified to be removed from the equation. Pretty simple. When you start looking at the things that have absolutely no function in the body, have absolutely no value added to the body, those are the first things you're going to examine. Do these need to go, or can they go? How do we get these out? And when you get them out of the way, then you get in the things that your body needs, all kinds of amazing things happen. So I'm going to go back to that quote that I always talk about the Hippocrates quote, where he said that the important thing is to know what kind of person has the disease, not what kind of disease the person has. So that's always going to be what we're going to be talking about. We're going to be looking at the whole picture and helping that person educate themselves and understand and give them the power to get themselves back to being the healthiest version. Regardless of what the diagnosis the person has, that's what we're looking at to improve upon that situation. And this is why we always say there's always something you can do in every situation, and there's always the next right thing to do, and we're here to help you figure out what that is and make sure that you're able to integrate that into your life and find a way to make it as easy and practical and pragmatic so that you can actually do it and experience the benefits of doing so. Okay, I believe that's all the things that we were going to talk about today, and I forgot to note that I was asked to speak a little slower, so I apologize about always burning through the information. But if there's ever anything that you need me to repeat or any questions, please let us know. And of course, you can just back up this video and watch it if it was too fast. Are there any other questions out there live right now? Okay, not. We're going to do 12:45 on Thursday. We will be back to be able to answer more questions as they come in. But keep the questions coming in. We've got some great events coming up in the Dallas-Fort Worth area. This Wednesday, we're going to be doing some education at a clinic in Arlington, and that's about digestion. And in December 5th in Fort Worth, the 4-day weekend theater is going to be open to us again. We're going to be talking about how food affects your mood, ways that you can increase your body's ability to keep a happy presence to it as opposed to falling into the blues that a lot of people fall into over the holidays. Foods you can do, lifestyle things you can do, making sure we're giving you the tools to keep you happy and healthy throughout the holidays. All right, guys, thanks for watching. If you have any more questions, you know where to find us. Have a good one.